Hello there, my name is Hannah Maswani and I'm the Director of Mission and Equity Consulting here with YWCA McLean County. For this week's Think About It Thursday, I wanted to address the hot button topic of vaccine hesitancy, particularly when it comes to vaccinations and boosters for COVID-19. As you know, we have been in a pandemic for over a year now. As of last week alone, the United States has reached over 47.6 million COVID cases since the beginning of the pandemic, and 770,000 lives have been lost directly due to COVID. You're also very likely familiar with the next looming shadow over the corner, which is the Omicron variant. This variant, which has proved particularly highly transmittable, more so than the Delta variant or any of its predecessors, was first located in South Africa. And I want to take a beat to address that it was the epidemiologists in South Africa that first detected it, not that necessarily it came from South Africa. So I want us to hopefully bypass a lot of the racism we saw at the beginning of the pandemic in terms of who brought what where. This is not what this is about. This is to highlight the information around the fact that already 19 countries have reported cases of the Omicron variant, and 70 countries and different territories across the world have increased travel restrictions since the discovery of the Omicron variant, and then also prior to the discovery of it. So while we feel like life is back to normal because you can go out and have dinner with the family, your kids are probably back in school, I'm in my office, things are very much not where they were pre-pandemic. Part of this change has revolved around a lot of the rhetoric or a lot of the ways that we talk about COVID. COVID, considering it is a physical, medically determined illness, has been really politicized in ways that women's bodies have been politicized, but also in ways that the common cold never was, right? So central to this debate around the politicization of COVID is, you guessed it, masks, and then also vaccines. Folks who have displayed hesitancy, reluctancy, or outright refusal to vaccinate or wear masks typically center around a kind of rallying cry for freedom and bodily autonomy. And yes, we at the YW always believe your body, your choice. However, we're hearing this rhetoric of it's my choice in ways that choice was never honored for Black women, for Black folks in general, for women in terms of the hypersexualization of children's bodies that we see through dress codes, right? So there's different avenues in which we're hearing the word choice and freedom used that are quite particularly politicized and uniquely politicized in regards to COVID. We're seeing a lot of news sources, whether it's Fox News or The Root, almost having this competitive tallying of which red and blue states have higher death counts and higher mandates versus higher infections. And it's become a sort of very cruel abacus of sorts, right? Where we are so politicized around this that we're forgetting it's about human lives lost. We're forgetting about the folks who live in fear of contracting this or those who are currently on ventilators fighting for their life, because it's become the political narrative of the day. A lot of this narrative centers around the idea of those who do get vaccinated or do choose to wear masks. One side will quote us as very weak, sheeple, that sort of thing. Whereas the other will say we're being respectful of those elders in our lives or those with autoimmune disorders or really just prioritizing our own health. Whereas on the other side, for folks who choose not to get vaccinated or not to wear a mask, there's the duality of that group of folks being considered either foolish or cutting off their nose to spite their face, but alternatively, they're being considered as deeply American and sort of symbols of freedom, right? Because that's where this tension lies. The issue with politicization around healthcare and around medical information is its ability to spread misinformation. So a study that was conducted just last month, November 2021, showed that about 8 in 10 folks surveyed didn't know where to go for correct information. So they had a survey of thousands of folks, presented truths and then facts around the vaccine, around how COVID is transmitted. And almost 8 out of 10 folks couldn't tell the difference or weren't sure about the difference. So the majority of all of us have been witness to misinformation, either intentional, deliberate, or unintentional, and we're not really sure what to do. So when you combine very valid health concerns with very binary thinking political division, and a lot of sort of mistrust of news sources, of politicians, of healthcare providers, it's sort of the perfect storm for just fear, because we're not sure what's the best thing for our bodies and what to do. What aggravates this politicization is this idea that folks might be faking papers, and all you need to do is look to a facet of social media or any news story, and you'll see different communities seeking to falsify papers in ways that are sort of taking a stand against systems. But I do feel the need to uplift that for international folks such as myself, for even domestically born students, we've had to provide healthcare records. We've had to get our MMR vaccines. We've had to, prove that we're well enough to engage in different facets of society. That's true for immigrants coming to America and immigrants from America going to other countries, right? So paperwork around healthcare has been normalized up until this point, right? And there's also the added fear that if you don't have the correct papers, or you are not able or willing to be vaccinated, or you don't have access to testing, that you might lose your job, because different companies, including healthcare providers, are sort of poaching employees off another, saying you can come work here and you don't need to get vaccinated, or alternatively, come work with us, you're safe, everyone has to be vaccinated. So again, there's this sort of two separate camps of just bubbling uncertainty and tension. And this tension exists across a lot of different levels. So we have to be intersectional in terms of how we see it, because when we think about American healthcare, we cannot forget the racist legacy thereof, right? So the historically horrendous Tuskegee experiment, where Black bodies were used to see what happened when syphilis occurred and was not treated, right? J. Marion Sims, who's often praised as the father of gynecology, experimented on Black women's genitals without any anesthesia because he didn't think Black women felt pain. So there's a lot of mistrust from Black and brown communities around healthcare providers, because historically there's been a need to have that mistrust, right? And there's also a lack of representation in healthcare. So we know that due to the nature of systemic racism in education, in the healthcare system, in terms of access to funding to go to college, there's literally not as many Black doctors as there are Black folks in the population, right? Like percentage wise, it doesn't correlate. And then when it comes to the marketing from whether it's local news or the CDC, typically the marketing around vaccine issues is really created with a white audience in mind. So how are we speaking to folks to eliminate this hesitancy? What sort of massively salt in the wound and really just aggravates the situation more is that Black folks are 2.7 times more likely to die than their white peers from COVID. And this isn't about a physical, biological anomaly. It's the compounding pandemic on a pandemic that means that statistically Black folks are less likely to have access to healthcare, or to good food, or to transportation to get to the doctor, or to have jobs that let you get time off to get vaccinated. And if you have a reaction to it, having the time off to recover from that, right? So there's this double bind of mistrust and lack of opportunity, and the numbers don't lie. These studies have been replicated in any number of places, right? So between the World Health Organization, and similar findings are being found across the world as well. However, because information is politicized and warped, I do want to emphasize that a lot of kind of more social media news sources have stated that it's folks of color who aren't getting vaccinated, but that's actually not the case. So as of last month again, 78% of all Latinx individuals, 73% and 72% of Black and Asian folks respectively are vaccinated, as compared to 56% of white adults who've received one or more vaccines. And the largest unvaccinated population in the US is actually white folks. When it comes to thinking about other identity groups, when we look at the queer community, as of August and now being December, we can imagine that this number has increased. But as of August, 92% of my LGBTQ friends and family have had at least one vaccine. And the reason, or one of the many reasons for the willingness to engage in safe practices and getting vaccinations is because for queer folks, particularly for gay men, this is not our first pandemic. A lot of the queer community has lived through HIV and AIDS alone is the reason for 15,000 deaths a year and a total of about 700,000 lives lost. So that's, tantamount to the lives lost from COVID, right? So for the queer community, we've already lived through, or I'm a little too young, but my older queer friends have lived through a pandemic that has decimated their population. So through the advent of medications like PEP and PrEP, there's been increased trust and respect and lives saved, right? So depending on your own unique background, your own cultural heritage, your own personal and, group relations to healthcare, it changes, right? It changes how we feel about things. But when we get down to brass tacks and we get down to the hard facts of it, the US, as of, again, December of this year, 2021, we're averaging about 94,000 new COVID cases a day. That's a 31% increase just in the last week of November. 38% of these new cases are in the Midwest. And we've just had our Thanksgiving holidays for those who've gotten tested, who might be planning on traveling for Christmas. It's not out of the question to imagine these numbers will continue to grow. All while remembering there are 47 million adults in the US who have not yet received a single dose of the vaccine. So there's a lot of politicization, there's a lot of misinformation. And so if I can leave you with one takeaway, one thing to think about on this Thursday, it's how you look for and receive facts and information around COVID, but also in general. Consider research. We've heard that phrase bandied around quite a lot, whether it's Nicki Minaj's research that was definitely disproven by her government, or whether it's the CDC and other legitimate health organizations putting out information. Think about research, do your own research, but hopefully that research extends beyond a couple of text messages or a couple of Facebook posts, right? You want to examine the sources that you're reading. That's why throughout this presentation and all my presentations, you'll note I provide sources so that you can fact check me. I encourage it. When you're looking at sources, when you're having people tell you stories, whether it's your doctor or your cousin, this was my experience with COVID, or I've heard this, that, and the other. Ask them where they've heard it from and what expertise led to that decision, right? So we know that to be an epidemiologist, you got to be in school for like 7 to 10 years. We know that Fauci and all of the other fantastic doctors, they've been considering pandemics and healthcare issues for decades. So I'm not the expert here. I'm presenting to you information about how to find experts, right? So think about the sources that you go to for your information. Are they peer reviewed? What are their motivations behind it, right? And then think about what feels healthiest and safest. Feel free to go back to earlier in this presentation and look at the numbers in terms of how many lives have been lost and the likelihood of reinfection of COVID, how much higher that is if you haven't been vaccinated, right? Because we know that you don't just get COVID once, you can get it multiple times. And folks all around the country and world, in effect, are experiencing long-haul COVID, which is just so significantly debilitating, right, in terms of one's physical and cognitive abilities. We know that a lot of us are now eligible for boosters, and this includes children. So this winter has been an exciting winter already. It's only the 1st of December, but we're having all this new research and all this new variants that we're finding. But we know that children are eligible for the vaccine. For those of you with kids who are concerned, for those of you with kids who might have had a really hard time with the vaccine and you're worried about your baby getting a fever or getting sick, know that the children who do get vaccinated receive a third of the dose, right? So taking into account littler bodies, littler doses, and know that because, as I said, when you're looking for your sources, who said it? Who's putting a name to it, right? Is it an anonymous source where there's no repercussions if you're wrong? What kind of studies were done? So when it comes to the eligibility of children for vaccines, this was the study that was done by the New England Journal of Medicine, right? So look into what brought people to a certain determination so that it can help you make your own determination. And for those folks who are maybe watching me kind of eye roll a little bit and thinking, is it really, really safe? Yes, it is. I will fully disclose that I'm a little bit nervous about getting my own booster shot, right? Because that second dose knocked me on my butt a little bit, right? It took me out for one, but here we are. And the thing that I always cling to is that it was a lot easier than actually going through COVID, right? So some of the hesitancy around getting the vaccine is the notion that how is it developed so quickly, but we don't have a cure for cancer yet, right? Well, the secret to that is funding. Because this pandemic, because COVID shut down the entire world to the point that goats were taking over the streets, the urgency of needing a vaccination for COVID is what led to the significant amount of funding that was given to research that other diseases don't get. That's why we have to have fundraisers for you name the disease, right? Because we're slowly trying to garner interest and what have you. So when it comes to COVID, the funding was there, which is why the incredible teams of doctors around the world were able to provide these vaccines. As I mentioned, the second dose, for some folks, you might get the fevers, you might get a wee bit of a headache. For others, you might take a couple days to get over it. Totally normal. It means that your immune system is working. And I have asked several doctors about this, so happy to be hit up in the comments for questions around that too, right? But don't be afraid to ask your own healthcare providers, your own PCPs about that. And if you were originally part of the quote unquote wait and see crowd, you know what I mean. You were sitting at home wondering, let's see how this hits them first before I go getting vaccinated myself. I just want to offer the kind reminder that it's been a year since the first clinical trials were done. And those of us who are vaccinated are still going strong, right? Still looking forward to getting boosters because we are less at risk of COVID and therefore more able to protect those we love and to protect our own bodily well-being. I also need to offer the reminder that historically, intentional vaccine sharing, intentional health endeavors have eradicated diseases like smallpox, right? So immunizations are a thing that a lot of people in the world still don't have and are experiencing death and physical illnesses more than us who are in America and in the developed world, so to speak. And smallpox was all but eradicated, right? Same thing for polio. It's through immunization that this happens. And so hopefully we get to a point where we can do the same with COVID and we can truly get back to our quote unquote normal. And then for those of you who may have already contracted COVID, maybe you had it last year and you're thinking, should be all right, don't need that vaccine. Well, your chances of getting reinfected are actually more than 2 times higher than if you don't get vaccinated. So always, always, always speak to your doctors, speak to your healthcare providers, and get that good data before making a decision. But know that vaccines are eligible. You can go to any of your local pharmacies, any of your local hospitals, and talk to folks who are in the know about it and try and pick apart what is the politicized messaging that's happening, what is being weirdly racialized, what is being divided up into this binary thinking, so that you can look to the experts, you can talk to your doctors, you can make informed decisions, because it's natural to be anxious, whether it's about the vaccine or about contracting COVID as a whole, right? But it's through information that we're able to make solid decisions. And so if you are able to speak to folks about it, look into information, speak to your employers if you need the time off to do so, but know that you have a right to feeling healthy, you have a right to feeling well, and hopefully we all get back to a society where we're not afraid of hugging each other, right? But before we can get to that point, it does require us unpacking a lot of the myths and misinformation around vaccines and vaccine hesitancy. Thank you for tuning in this week. I've been Hannah Maswani, and it's been a pleasure talking to you today a little bit about vaccine hesitancy.